So what I'm going to show you today is a quick method of traction, 2 or 3 different ways to do it, that can really change your practice considerably. This is something that people can do at home too if they can get someone that will help them out. The traditional method of traction, when you want to do cervical traction for a neck problem, is really simply sort of pulling on the head there. And I think you can get a little bit of momentum from that. Maybe 15 pounds might be pushing it, 5 pounds. But what I recommend you do is take your hand and think of it as almost like a big tree frog hand that's nice and grippy. And normally I will prep the area with something that's going to not only relax it, but start to decrease a little bit of pain, so there's no spasm pain cycle going on. And then once that's in there and dry it a little bit, take your big tree frog hand and put it underneath the occiput. One hand over the top that's just sort of holding downward, and give a nice pull. Now, if this is done properly, you'll probably be able to feel it all the way down the spine, or you'll feel it down about as far as where the first restriction starts. You should have between 1 and 2.5 centimeters of elongation. Right now she's having a little bit of a cervical problem and a mild headache. So as you can probably tell, there's definitely not a centimeter of elongation, which means somewhere in the cervical spine, there's some restriction. This is going to be uncomfortable to you. This can take up to 6 months to get to where you can feel this properly. But the payoff is that you're going to get not only a regular cervical traction, but you're going to get a fascial traction throughout the whole spine that's going to feel amazing to the patient and is going to decompress the cervical area. Now, in lieu of that, the next best thing that I've seen as far as traction goes is with a towel. And this doesn't take as much finesse, but it's something that can definitely be done at home with a partner. Take a towel and roll it up. You want to also put it under the base of the skull, and then just really simply making sure that the ears are down. You want to give a pull and a lean backwards. That's the old physical therapy way of doing things, and it really does provide an excellent traction, and it's a little easier on your body. This particular type, done several times a day, can be a little bit hard on your arms and your elbows and things like that. But anyway, I think it's well worth what you would go through to try to learn it properly. Anyway, cervical traction, I feel, should be done with almost anything that has to do with the head and neck. It should be like your go-to point. It should be like your reset point. Do a little bit of work, cervical traction. Do a little bit of work, cervical traction. In very rare cases will it ever cause any discomfort. If it does, that means there's some sort of ligament damage in there that does need to be addressed in a different way. Thanks.